Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman. I hope you're learning a lot and absorbing what we're talking about. I have a patient who came in this week, 74-year-old man, married, with esophageal cancer. He also had a bone marrow disease. He was seen in one of the hospitals in the 5 boroughs, and then he was transferred to one of the big super pooper hospitals in Manhattan, and he had a biopsy of the esophagus. Now, at this place, they told him he just had a little spot on the esophagus, and he brought all his records, and I showed the family. He has adenocarcinoma. He has an invasive cancer of the esophagus. He's eating pureed food. His weight went from 170 down to 145 pounds, so he's lost a lot of weight. He's eating pureed foods, and they're not offering him any treatment for his invasive cancer of the esophagus. So he and his wife came in. His wife is a very strong advocate for him. He's more mild-mannered. They want to be treated, and he deserves to be treated, not just to be sent home. They're giving him blood transfusions for the blood that he doesn't have or that he's losing, but they're not treating the cancer. He's lost weight. He's had difficulty swallowing. He has a cancer that can be treated to try to help him, to try to eat better, and hopefully stabilize his weight and stop the bleeding. So that's the kind of work we do, and our work is non-invasive. So we do treat esophageal cancers. We actually treat cancers of most part of the body. We also treat some benign tumors, like in the brain, meningiomas, acoustic neuromas, pituitary tumors. We treat chordomas. So we treat cancers, primary cancers or metastatic. We treat them when they're initially diagnosed or recurrent. This is a man who has initially diagnosed esophageal cancer, but he's not getting the treatment that he wants. And the patient is the president of the United States of the body, and the spouse is the co-president, and the doctor is the advisor to the president. The doctor works for the patient. It's not the opposite way around. It's not the patient is there for the doctor. No, the doctor is there as the advisor to the president of the United States. That's you and your body. And just like the president of the United States, if he doesn't like his or her advisor, they get the boot. And we know that, so we have to be responsive. When I was at Harvard Medical School, one of my professors, C.C. Wong, said you need the 3 A's. To be a successful doctor, you need the 3 A's. What are the 3 A's? You need to be affable, you need to be able, and you need to be available. If you're able but you're not available, it's not good. And if you don't communicate with the patient, if you're not affable, it's not good. You have to be able, affable, and available. The 3 A's. That's what we try to do. Speaking of that, here's a story. Now, this patient I've heard about for 6 years. His best friend is a urologist I work with. This man is 69 years old, has 2 kids. He was diagnosed in 2002 with a melanoma on the cheek. He was treated for the melanoma on the cheek. And then in 2006, believe it or not, he was not staged up, even though melanoma is one of the most aggressive cancers and spreading skin cancers. And it's a reminder to put on the sunscreen in your hat and a long-sleeve shirt today. Yes, please do it. Even when you go out to the grocery store, put on some sunscreen and a hat, please. So he had a melanoma on his cheek, a sun-exposed surface. Remember, sun-exposed surface. In 2006, he was seeing a pulmonologist about a nasal drip, and they did a chest x-ray, and only because they have a nasal drip, they found the cancer. He wasn't staged up by his cancer doctors, but by the pulmonologist looking for a post-nasal drip, and they found the cancer traveled to the mediastinum. Now, he started on interleukin treatment, and he couldn't take it. He went into kidney failure. His creatinine went from 1 to 4, so he was in serious kidney failure, and he just couldn't take the interleukin. I'm not sure it even worked. And then he had another immunotherapy treatment. After 9 cycles, he had complications of bleeding. And then for 5 years, he's been on another drug, and for 5 years, they told him that it's working. Now, over these years, it's at a big cancer hospital, famous place. They kept telling him it's working, it's working, it's stopped, it's working, it's stopped, it's working, it's stopped. But he never saw the pictures, and he never saw the reports. And his friend, who's a colleague of mine, has told him for years, why don't you see Dr. Lederman, why don't you see Dr. Lederman? And the guy said, I'm at the big cancer hospital, they have to do the best, they have to know the best. Well, he sat down, he and his girlfriend sat down with me this week, and we got a radiologist there, and the radiologist said that this cancer has been growing for all these years. In 2008, it was 5.6 centimeters. In 2011, it was 8.3 centimeters. Then it was 9.3 centimeters in 2013. Now it's 13 centimeters. This cancer in his mediastinum. The mediastinum is a part of the body between the heart and the airway, between the 2 lungs. It's a critical area. It can close off your air supply. It can close off the blood, the air going to your lungs that sustain you. So this cancer is growing from nothing at one point to 5 centimeters, to 8 centimeters, to 9 centimeters, now 13 centimeters. The total volume is 1,000 cc's. It's a liter. He has a liter of melanoma in his chest. We staged him up, and there's no other cancer anywhere else. So it's a cancer, malignant cancer in the bloodstream. It spread from the cheek to the chest, but it went nowhere else. For all those years, he was getting treatment elsewhere at a big cancer hospital, and they didn't tell him the cancer was growing. I'm sure he would have never continued the treatment for all those years, 5 years, if he knew the cancer was growing. He came to us, we staged him up, he got the documents, he saw the comparison, he's learned all the options, and he's getting radiosurgery. Our success rate with melanoma is 90%. 90% of the time we can stop it, shrink it, or make it go away. By the way, we're just about at the end of the hour. If you want to tune in tomorrow, we have 4 shows on WOR, which is 710 Radio, one at 1:30 in the morning, one at 3 in the morning, one at 6 in the morning, one at 9 at night on WOR. If you have medical questions today, please call us at 212-CHOICES, which is 212-246-4237, 212-246-4237. We try to do the right thing. We'll send you a booklet DVD. Just give us a call. Thank you for tuning in today. Have a great weekend. God bless you. This is Dr. Lederman saying bye.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
You know, when you're talking the big C cancer, a lot of times people have gone through prior chemosurgery or radiation, and it just didn't work or didn't get the desired effects. All of a sudden, you want to get an opinion on what to do. Well, Dr. Gil Lederman treats not only newly diagnosed and recurrent cancers anywhere in the body, but definitely will specialize with those folks who already been through a process that didn't work, and now they're trying to reconfigure in terms of what they can do, and he goes one-on-one with you. In fact, he'll send you an informative booklet, DVD, and arrange a prompt meeting to discuss all choices at his convenient office located on 38th and Broadway in Manhattan. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. And back in 1991, I referred my dad to Dr. Gil Lederman, and he came up with a solution for his medical problem. Harvard-trained radiation oncologist first brought non-invasive stereotactic body radiosurgery to America. He has the longest experience treating cancer using radiosurgery with no cutting, bleeding, anesthesia, or hospitalization. So just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES. Write that number down if you want to refer someone to call, or call Dr. Gil Lederman for that person at 212-CHOICES. That's 212-CHOICES. Choices. 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 Choices.